Turning our attention now to the ASX, here's Matt Burney and Bulls and Bears with the latest public company views and interviews.
Welcome to Bulls and Bears, brought to you today by healthcare technology company OneView Healthcare, ASX code ONE. I'm Matt Burney and I'm joined now by the CEO of OneView Healthcare, James Fitter. Hi, James.
Good afternoon, Matt.
Tell me about the digital tablets you provide to patients in hospitals. What are they used for and how do you make money out of them?
Think of us as being where consumerism meets healthcare. So it's a tablet at the bedside. It's integrated into a whole bunch of systems in the hospital that typically don't talk to each other. We're trying to provide one view into those disparate systems, and that includes everything from entertainment, meal ordering, most importantly, telehealth, and our customer is the hospital who pays us.
And so if you control patient data, I'm guessing security and privacy becomes an important issue for you. How do you deal with that?
Never been a bigger issue, and that's really why we set out on this journey a couple of years ago to get independently certified. So we've been working with International Standards Organization, which is recognized in 165 countries. Back in March this year, we achieved ISO 27001 certification, which speaks to our information security management systems. And just last week, we became ISO 27701 certified, which talks to how we handle personal private health information, which is obviously incredibly important in the healthcare space.
How many hospitals use your system? How many countries are you in? And what sort of customer growth have you seen recently?
We're currently in about 10,000 hospital beds across 60 different hospitals in 5 different countries, primarily in the United States and Australia. So we're in 3 of the top 20 hospitals in the United States. We're in nearly 20 hospitals in Australia. Some of the names you'd be familiar with would be Epworth Healthcare. We're in the Mater in Brisbane. We're in the Sydney Children's Network in Sydney, and the Chris O'Brien Lifehouse. So we've got a really good footprint.
Importantly, what was your annual recurring revenue last year, and what sort of growth have you seen in those numbers?
Good question. So last year we did, in Aussie dollars, we did about 8 million, which is nearly tripled over the last 3 or 4 years. So we've guided that we're going to grow our total revenue by 50% this year, because it's become increasingly apparent that having patient technology at the bedside is incredibly important for the care team to enable video communication between care teams and between family members and their loved ones.
I see you've got a few big name partners like Samsung and Microsoft on board, so it looks like you may be doing something right. James Fitter from OneView Healthcare, thanks for joining me on Bulls and Bears today. And remember, we're only here to give you information, not advice, which you should of course seek independently. I'm Matt Burney and this is Bulls and Bears.
For more public company CEO interviews, go to the Money page on the 6PR, 2GB and 3AW websites and click the Public Companies tab.